Good day, everyone. I am Reynabel Janice Dencel Mateo, a Medical Officer 4 of the Health Facility Development Bureau and the Program Manager of the Patient Safety Program of the Department of Health. Welcome to the first module of this course. We will talk about the policies guiding the Patient Safety Program, namely the National Policy on Patient Safety in Health Facilities and the National Patient Safety Program Strategic Plan.
At the end of the module, we should be able to recognize the context and need for patient safety and quality improvement on a wider scale. Before we proceed with the first policy, let me first introduce the Health Facility Development Bureau. The Health Facility Development Bureau, or the HFDB, is currently under the Health Facility and Patient Support Team, or the HFPST, which is led by Assistant Secretary Sharade B. Mercado Grande. The HFDB, headed by Director Maria Teresa Vera and Director Melissa T. Sena, is primarily composed of three divisions. These are Policy, Planning, and Program Development Division, Health Systems Development and Management Support Division, and Health Facility Performance Management Division. Pursuant to EO number 366, the HFDB was given the mandate to develop plans, policies, programs, and strategies on health facility development, planning, operations, and management, provide coordination, technical assistance, capacity building, consulting, and advisory services, and advise the SOH and the Undersecretary of Health on matters pertaining to this scope and coverage. At this point in time, we would also like to acknowledge our collaborators for this basic course on patient safety and quality. The basic course was developed in cooperation with the University of the Philippines College of Medicine Program for Healthcare Quality and Patient Safety, which is headed by Dr. Diana R. Tomondong La Chica. The research speakers in the following modules are the program's members. So why would we allot our time and resources for patient safety? I'm sure everyone in this room has been a patient before or knows someone who has been. One way or the other, we've all interacted with the health system. The patient safety aims to prevent all avoidable harm in any interaction with the health system, ensuring both the safety of patients, care providers, and health workers. With that in mind, the Department of Health recognizes patient safety as a fundamental element of universal health care. In particular, there is a need to match our systems with the ever-evolving nature of health system provision. As complex procedures increasingly become the standards of care, there is also an increasing probability of error. Hence, systems must be in place to ensure patients and healthcare workers remain safe and that quality care is accessible and continuously provided. Anchored on the UHC law and the call of the 72nd World Health Assembly on Global Action Plan on Patient Safety, DOH is reaffirming its commitment to promote and integrate patient safety in health service delivery to improve health systems and outcomes. This is to ensure the alignment of the patient safety program to overall implementation of universal health care, with the aim of preventing avoidable harm in prevention, diagnosis, treatment, and follow-up. As a result, the National Policy on Patient Safety in Health Facilities was crafted, and the National Patient Safety Program Strategic Plan for 2023 to 2028 was developed. Now let me introduce to you the Administrative Order number 2020-0007, or what we call the National Policy on Patient Safety in Health Facilities. As a quick background, this policy was guided by the principles of the 2008 National Policy on Patient Safety, but with more concrete guidance on the implementation of patient safety, specifically in health facilities. It also emphasizes the specific duties of the Patient Safety Unit or Patient Committee and Patient Safety Officers. The objective of the policy is to provide guidance on the effective implementation and institutionalization of the patient safety program in health facilities to improve patient safety in health service delivery, including that of the vulnerable population. This shall apply to all government and private health facilities providing preventive, promotive, curative, rehabilitative, and palliative care. For the definition of terms, we have the following. Adverse event is a preventable or accidental injury or illness caused by medical management which requires additional monitoring, treatment, hospitalization, or that result in death. A sentinel event is the most serious adverse event which causes permanent harm, severe or temporary serious injury, or death. Risk management is composed of clinical and administrative activities undertaken to identify, evaluate, and reduce the risk of injury to patients, staff, and visitors, and the risk of loss to the organization itself. Culture of safety, on the other hand, is an integrated pattern of individual and organizational behavior based on shared values, attitudes, perceptions, competencies, and patterns of behavior that continuously seek to minimize patient harm that may result from the process of care delivery. Lastly, no blame culture is a non-punitive culture encouraging voluntary reporting of adverse events. Here, we recognize that the system or process failed and not the individual. Hence, the system must be investigated. The National Policy on Patient Safety in Health Facilities provides guidance on the effective implementation and institutionalization of the Patient Safety Program in health facilities to improve safety in health service delivery, including that of the vulnerable population. The guidelines include the following: institutionalization of the Patient Safety Program in all health facilities at all levels of care. Engagement and alignment of various stakeholders shall be done for effective patient safety program implementation and attainment of health systems goal, and the prioritization of the establishment and maintenance of the culture of safety and no blame culture. Now we will go to the specific guidelines of the issuance. What standards are expected to be implemented by the health facilities in institutionalizing the patient safety program? 1. All health facilities shall have a patient safety unit with a designated patient safety officer to oversee and manage the program. 2. Each health facility shall formulate policies and guidelines aligned to the national strategies on patient safety to facilitate the implementation of the program. 3. Each health facility shall conduct baseline assessment of patient safety status and overall burden of unsafe care. 4. A proactive reporting and learning system shall be institutionalized in the health facility. This requires the leadership to encourage reporting of events in a protected, no-blame culture environment. The reporting system shall ensure the confidentiality of individual cases. The events shall be documented, and annual reports with summarized events and action taken will be made available to the management of the health facility. 6. Proactive risk management and strategies shall be employed to prevent adverse events through patient risk assessment, patient feedback surveys, health technology assessment, and the use of safety checklists. 7th, targets and activities on key priority areas shall be met first. 8th, safety checklists shall be developed by the DOH through the Health Facility Development Bureau. 9th, all healthcare workers shall undergo training upon entry and subsequently augmented annually by continuing medical education with focus on improving decisions and clinical judgments and recognition on and awareness on patient safety issues. Training and development activities shall be given budget allocation. 10th, Annual World Patient Safety Day shall be celebrated in all health facilities every September 17th. Under the overarching goal of providing safe and quality UHC, the goal of the patient safety strategy is to improve patient safety at all levels of healthcare, in both public and private sectors, from primary to referral level, and all modalities of healthcare, including prevention, diagnosis, treatment, and follow-up. The objectives of the patient safety strategy are to improve the structural systems to support quality and efficiency of healthcare, and place patient safety at the core of all levels of healthcare to promote culture of safety. Assess the nature and scale of harm to patients, and establish a system of reporting and learning at the national level. Ensure a competent and capable workforce that is aware and sensitive to patient safety. Prevent and control healthcare-associated infection. Improve implementation of global patient safety campaigns and strengthen patient safety in all health programs, and strengthen capacity for and promote patient safety research. The first strategy is to have health facility operations and management systems that promote culture of safety, focusing on the following activities: leadership and management commitment to patient safety, ensuring a safe environment in the health facility, health personnel safety is established, medical record system is completed, and patient-centered care. In institutionalizing the patient safety in health facilities, a strong leadership is necessary to steer the direction of the program aligned with the national strategies. To support this, a quality improvement, infection prevention and control, and patient safety unit has been included in the Phase 1 of the revised standards on organizational structure and staffing pattern of Level 3 government hospitals, which is now published as DBM-DOH Joint Circular Number 2022-3. This unit is currently being proposed as well in the revision of the staffing standards for Level 1 and Level 2 hospitals. The creation of this unit is to ensure that the aforementioned programs based on international standards are implemented, monitored, and streamlined at the health facility level. The unit or committee shall be composed of multidisciplinary members with representatives from the administrative and medical staff and patient partners from patient groups. Their function is listed in the slide, which includes the following: formulate and implement policies, guidelines, and procedures aligned to the national strategies for patient safety, coordinate and disseminate information to all departments, sections, and services of the health facility for the implementation of the patient safety program, advocate and promote the no-blame culture and culture of safety to all health personnel in the health facility, formulate mechanisms for systematic adverse event reporting and surveillance, organize and provide training and guidance to the health personnel related to the patient safety and implementation of standards and guidelines, collaborate with partner agencies and other stakeholders in the health sector in pursuing program objectives, conduct meetings at least once a month and whenever necessary in order to consolidate, analyze, and act on reports related to patient safety, and perform risk management activities to mitigate risks due to adverse events and to learn to prevent future recurrence. Part of the activities also mentioned in the national policy is the use of safety checklists. The DOH endorsed the Philippine College of Surgeons modified WHO Surgical Safety Checklist. This was modified in the context of practice in Philippine healthcare facilities and developed in consultation with Operating Room Nurses Association of the Philippines. The modification also included supplementary forms such as the Safety Officer Checklist and Pre-Op Huddle Checklist. The pilot testing was done in 17 hospitals composed of 9 private, 5 DOH, and 3 LGU hospitals with 227 individual respondents composed of 114 nurses, 79 surgeons, and 34 anesthesiologists. Feedback was taken from respondents on the ease of use, time needed to use, perceived improvement in team communication, and others. Another patient safety checklist that can be used even for primary care facilities is the WHO Safe Childbirth Checklist. Advocacy campaign for patient safety is annually conducted as the World Patient Safety Day every September 17 as well. Health facilities are expected to provide adequate funding and to conduct activities relevant to the program. The second strategy that wishes to assess the nature and scale of adverse events prescribes the following activities: implementation of a surveillance system for nature and scale of adverse events, and usage of incident reporting system and risk mitigation strategies. The third strategy, on the other hand, aims to do the following: strengthening education, training, and professional performance inclusive of skills, competence, and ethics of healthcare personnel, and improving the understanding and application of patient safety and risk management. The fourth strategy emphasizes strengthening of the infection prevention and control program across all healthcare services and to employ a system to reduce HAI in the facility. While the fifth strategy focuses on the following: patient identification procedures and protocols, effective communication, medication safety, safe surgical care, blood safety, safe childbirth, safe injections, and fall prevention. Encompassing the first 5 strategies of patient safety indicators were identified by the Patient Safety Technical Working Group to monitor and evaluate key priority areas for patient safety in the Philippines. So what are patient safety indicators? According to the Agency for Healthcare Research and Quality, PSIs are a set of measures that can be used with hospital inpatient discharge data to provide a perspective on patient safety. PSIs specifically screen for complications or adverse events. The core indicators cover the first 3 objectives of the patient safety strategy. These core indicators include data on the facility's utilization of electronic health record, information management system, healthcare provider to bed ratios, and reporting of never events and near misses. It also includes an inclusion of the patient safety program in the facility's annual budget and engagement of patients. The patient safety indicators on key priority areas, on the other hand, targets the following: patient identification, effective communication, safe surgery, medication safety, and fall. Specifically for strategy number 4, the patient safety strategy, which is to prevent and control healthcare-associated infection control indicators are measured. All of these patient safety indicators are already available for all health facilities submission in the DOH Health Facility Profiling System as part of the 5 previously mentioned strategies and to establish a system of reporting and learning at the national level. These indicators will serve to guide us towards informed policy decision-making by using baseline data on patient safety to support crafting of priority policies and finally implementing them. Lastly, to strengthen capacity in conducting patient safety research, the following activities can be done: facilitate the conduct of patient safety research as a priority topic in training and research health facilities, train the staff to use scientific research tools to address patient safety problems, facilitate access to scientific publications and articles, strengthen ethics committee to oversee patient safety research, ensure wide dissemination of research results and translating successful interventions into a form that can be replicated, and conduct cross-sectional studies to assess the magnitude and nature of adverse events. Now that we have established the importance of having a national policy on patient safety and its related strategies, let us now discuss the National Patient Safety Program Strategic Plan, which aims to provide a detailed roadmap and overall direction in the planning, financing, implementation, monitoring, and evaluation of the National Patient Safety Program in health facilities. The program strategic plan was completed in 2022 in alignment with the continued commitment of the Philippines with the WHO Global Patient Safety Action Plan 2021 to 2030. This was developed with a technical working group representing key stakeholders and experts such as patient and patient partners, academe, patient safety hospital practitioners from government and private institutions, and primary care providers. The vision is that by 2028, all health facilities embody the culture of safety for patients and healthcare workers. The mission is that the Patient Safety Program leads health facilities in the provision of people-centered health services and the development of healthy workplace conditions for healthcare workers through collaborative and evidence-based strategies. The objective is to achieve a 25% increase in health facilities with data-driven implementation of the Patient Safety Program within 5 years. The program shall employ 7 major strategies to move the implementation of the Patient Safety Program across different health facilities. This includes leaders as champions for patient safety. Patient safety standards are developed and implemented in health facilities. Learning and development opportunities for patient safety are made available and accessible. Culture of safety is promoted through advocacy efforts. Program implementation is responsive to the needs of patients, care providers, health workers, and health facilities. Networks and linkages across programs and stakeholders are strengthened and maintained, and monitoring and evaluation of the program is strengthened and aligned with culture of safety. The program will focus on activities related to the following: engagement with stakeholders such as health facilities, local government, academe, and non-government organizations, incorporation of patient safety personnel in Level 1 and Level 2 staffing pattern, continue its advocacy activities to empower patients, care providers, and healthcare workers, develop courses on patient safety readily available in the DOH Academy, and strengthen evidence generation through the integration of patient safety indicators in the patient safety module in the health facility profiling system. The National Policy on Patient Safety in Health Facilities provide guidance on the effective implementation and institutionalization of the Patient Safety Program in health facilities. The National Patient Safety Program Strategic Plan 2023 to 2028 provide a detailed roadmap and overall direction in the planning, financing, implementation, monitoring, and evaluation of the National Patient Safety Program. And that is all. Here are the references for this module. Thank you for your kind attention and good day.